to part 2 of our webinar series. We're going to give individuals a few moments to log on, but we are very grateful that you have decided to spend for some on the East Coast, lunch hour with us, and some in other coast, their hour before or 2 hours before their lunch break. So we'll just pause for a little bit and give people an opportunity to log in. Today, we are going to take some time to talk about how to address some of the unmet social needs that our patients experience that impact their health. This series aims to provide valuable insight, expert knowledge, and practical strategies that you can apply to the work that you do every single day. We can go to the next slide. My name is Dr. Nicole Franklin, and I will be moderating this series for you. I am a board-certified health psychologist by trade, but I am functioning as the co-chair of the Integrated Health Multidisciplinary Care Committee at ASMBS. I am honored to be able to talk with you today about some of the social determinants of health that have really been impacting care and what we can do to ensure that we are addressing these needs for our patients. But before we dive into today's session, I want to take a few moments to go over some housekeeping rules and some disclosures. Our webinar is going to last for approximately 60 minutes. At the end of our webinar, we will have time for a question and answer session. Please take the time throughout the evaluation or throughout the session to put your comments or questions in the chat box. We will field the chat box and answer as many questions as we possibly can at the end of the session. I do want to let you guys know that the webinar is being recorded and will be available on ASMBS's website once all of the final edits have been done. Our speakers do have links within the webinar that have been checked as of today to make sure that they are active, but with our ever-evolving changes, they may not always be, but do know that our presenters have done their due diligence to ensure that at the time of presentation, they were active. Lastly, we strive for transparency. So I want you to know that none of our presenters have any financial or personal conflicts of interest. If we go to the next slide, it'll show our disclosure statement that speaks to that as well. Now, without further ado, I want to jump into today's presentation. I am excited to introduce our speakers. We can go to the next slide. You will see our first speaker is Dr. Jenna Heimowitz. She is the Director of Metabolic and Bariatric Psychology at Stony Brook Medicine Bariatric and Metabolic Weight Loss Center. She has appointments in both the departments of psychiatry and behavioral health. Dr. Heimowitz has an extensive history of leadership roles within ASMBS. She is an Integrated Health Fellow, the past chair of the Integrated Health New York chapter, and the past chair of the Integrated Health Multidisciplinary Care Committee. Next slide. Our second speaker will be Matthew Selleck. He is a registered and licensed dietitian that is a team member at Ohio State University within their comprehensive weight management program that includes metabolic and bariatric surgery. He is also a member of the ASMBS Interdisciplinary Health Committee. And our final speaker will be Catherine Tepa, who goes by Kathy. She is the manager and coordinator at Stony Brook Medicine Bariatric and Metabolic Weight Loss Center. She is also a certified yoga instructor and physical therapist. Throughout her career, she has held many leadership roles, including the chair of the Integrated Health New York chapter, member of the Professional Education Committee at ASMBS, member of the Integrated Health Multidisciplinary Care Committee at at ASMBS, and member of the Advanced Metabolic and Bariatric Nutrition Task Force. So, like I said, a very, very esteemed group of panelists that we have today. Dr. Jenna Heimowitz, you now have the virtual floor.
Thank you, Dr. Franklin. And today we will be discussing tools to address health disparities. But before we do that, I wanted to orient everyone to some key terms relevant to this discussion. We can begin with health equity. So as you could see here in the picture to the left, health equity implies that everyone has a fair opportunity to achieve their full health potential. It involves really removing unfair and avoidable differences among groups of people. With health disparities, these are a particular type of health differences, preventable health differences that are closely linked to social, economic, and/or environmental disadvantage, whereas with social determinants of health, these refer to the conditions in which we live, our built environments, our access to education, economic stability, as well as access to green spaces and things like that. So really where we live, learn, work, play, worship, and age. And while everybody experiences social determinants of health, some populations and individuals might have health-related social needs, and these are more immediate needs. So housing insecurity, food insecurity, and access to reliable transportation. Now, understanding social determinants of health and addressing health-related social needs is really critical to reducing health disparities and promoting health equity in our communities. While access to high-quality healthcare is important, estimates indicate that up to 50% of an individual's overall health is determined by social and environmental conditions. And so you could see some of these factors in the figure to the left. And research shows consistent and significant disparities in obesity outcomes among populations, with many studies showing that obesity impacts individuals from minoritized groups and low-income adult populations disproportionately. In the case of our patients, research also suggests that social determinants of health impact access to and utilization of metabolic and bariatric surgery. Some unpublished data from preliminary studies out of our research group suggests a relationship between social determinants of health and likelihood of undergoing metabolic and bariatric surgery, and between social deprivation and nutrition after surgery, with individuals with more social deprivation less likely to have MBS and more likely to be lost to follow-up after surgery. Again, these are unpublished data, but it just suggests that we are seeing some of these trends and that relationship between these social determinants of health as they affect our patients and access to care and engagement in treatment. So the literature supports a complex association between mental health and obesity, with individuals with obesity experiencing higher rates of some mental health concerns and higher rates of obesity in individuals with certain mental health conditions. There's also well-documented evidence for disparities in mental health care. And so we see disparities in access, use, and quality of care. And it's not just disparities related to race, gender, ethnicity. We see disparities or mental health disparities related to age. We also see that when we have intersectionality among different social identities, that might increase risk of mental health disparities. So there's robust support in the literature suggesting associations between discrimination and mental and physical illness. So discrimination can be considered another social determinant of health that impacts access to care. And on the left-hand part of this slide, you could see some of the medical and mental health conditions that have been associated with discrimination. So we see mortality, we also see cardiovascular disease, as well as things like PTSD, depression. So one type of discrimination that we're all familiar with is obesity stigma and weight-related discrimination. So many studies show that experiencing obesity stigma contributes to disparities in several areas and also has a negative effect on multiple domains of health, some of which are included here. some of the research that I'm doing with my research group has been showing associations between weight-related abuse and stigma and eating behaviors. The literature also supports associations between weight-related abuse and or weight-related stigma and physical activity avoidance, as well as other health behaviors. And we do see an association between weight-related stigma and mortality, with an increased risk of mortality in individuals experiencing weight-related stigma. So what could we do about this? So the CDC has identified 6 areas for addressing social determinants of health to improve health equity. And so they suggest addressing things at the level of policy and law, as well as the community level through our partnerships and collaborations. And at the federal level, there has been some progress. There have been some laws passed and some policy changes with the aim of addressing some of these disparities. Um, and so this includes a mental health parity and Equity Act. We also see some efforts through the Affordable Care Act to increase funding for disparities research and promote prevention programs. And hopefully we're all aware of TROA, which aims to increase access to intensive behavioral health treatment for individuals with obesity, and to also increase access to obesity medications. There are also some things being done at the state level. These are some examples. These are taken more from the National Diabetes Prevention Program, but these are some examples of just how states are collaborating with their partners, community-based organizations, to help address health-related social needs. In Maryland, they've done a good job at increasing or facilitating referrals to community-based organizations and identifying patients who might be eligible for the diabetes prevention program. And these might be some examples that we could use as models as we think about how we could increase access to obesity care for our patients more at the state level, and some areas of potential advocacy that we can consider. And now I'd really like to talk about some of the things that we're doing at our institution. I do acknowledge that not everybody is affiliated with an academic medical center and might not have access to these resources. And I do encourage everybody to really find out what resources might be available at your institutions or in your area that might be similar. So at Stony Brook, we have our Stony Brook Heights. So this is a micro farm located on the rooftop of one of our health science center buildings. It yields about 1,500 pounds of produce each growing season. And the produce is donated weekly to our student food pantry, as well as our WIC program and other food pantries in our community, in addition to donations going to Stony Brook Home, which is our free student-led clinic that provides primary care services as well as mental health services to uninsured adults on Long Island at no cost. We also have our food pharmacy, which is a food pantry that helps Stony Brook medicine patients with cancer and or diabetes who are impacted by food insecurity. And then we have other programs such as our Tai Chi for arthritis and falls prevention, and that's located or facilitated through our trauma center, and it's free for patients. It's located online, so it can address some of those mobility and transportation difficulties that some of our patients do face. So what could we do at the practice level? So one thing we could do is consider collecting data so we could really identify the specific needs that our patients are facing. So we could collect data through our EMR during our intake when we're talking with patients and document this as consistently as possible. Collecting this information also helps us to evaluate our progress. So if we're implementing any changes, we could see how well our programs and these changes and how effective they might be for our patients. Another thing we could consider is identifying any difficulties with obtaining or access to translated materials, access to interpretation. One thing to consider is creating resource libraries. And so pooling together our resources and creating more of a centralized location or handouts that we could give to patients with some of the websites and information about some of the programs that might be available to them. At the practice level, we could also identify and help facilitate referrals to case managers and help you provide education to other providers in our practices about some of the resources available, about how to link patients to appropriate care so their needs are met. One thing that I have been doing with some colleagues is with some students, we've been going out on community tours to discuss and to develop relationships with community-based organizations. So we could take a tour of their facilities, learn about their programs, learn about what they could offer, and also talk about how we could collaborate or find a way to streamline the referral process to some of their case management, legal services in some cases. We've taken tours of food pantries as well, which can provide also additional social services and case management for some of our patients. At the individual level, we could all advocate for our patients, identify their needs, and advocate for them at the practice level as well as the institution level. I know the state chapters of ASMBS do a lot of advocacy work, as well as ASMBS, the national organization. So just thinking about different ways we could help our patients by giving them a voice. We could also take it upon ourselves to know what resources are available in our communities and try to share this information as much as possible. And importantly, we all want to take some time to identify our own conscious and unconscious biases so they don't impact our patient care. And this includes paying attention to the language we use with patients, using person first language. These are things we've been discussing for several years at this point. I know with regard to weight stigma, our conference in the summer, spring is going to be addressing and talking about some things that we could do and providing additional education about how to prevent weight stigma and how to address these biases. So now I'd like to take a couple of minutes to talk about resources. So I'm focusing on more mental health resources that can be useful for patients who are underinsured or having difficulty finding mental health providers who accept their insurance. I often direct patients to sliding scale providers and websites and directories that might be able to help match them with sliding scale providers. So Psychology Today is one. There are also a lot of sliding scale options at university clinics where patients could receive evidence-based care from psychology, social work trainees who are supervised, but often these are lower cost options for patients. And now a lot of trainees are learning how to use telehealth, so there might be telehealth options if transportation is a difficulty. There are national organizations that have free support groups as well as search engines to help connect patients to care. Group therapy is another nice option that could be a little bit more cost effective, yet produce very similar, if not, better outcomes than individual therapy. This is something that we do offer through our institution. We have a lot of group therapy options to help with stress management, depression, anxiety, addiction. So this is something that I do refer a lot of patients to because it's easier to get access to care that way. For veterans and their families, there are a lot of options through the VA and a lot of resources through the VA. So they offer individual and group therapy options. But the VA is another resource for free apps that review and provide access to mental health resources and skills training, as well as tracking options. And they also have a lot of educational materials on their website that's open to anybody. With regard to prescriptions and psychiatric medications, some patients who have trouble affording their psychiatric medications, I encourage them to do some price comparison between pharmacies, sign up for any prescription discount cards, and to ask their psychiatrists and psychiatric nurse practitioners about samples that might be available to them. So if our patients are dealing with housing insecurity, if they aren't able to keep their lights on, if they're dealing with food insecurity, then it's really difficult for them to adhere to our recommendations and to consistently come back for follow-up care. And there are some websites and phone numbers that can be that are more of open to everybody at a national level, such as 211 and 211.org. And with 211 and 211.org, patients could be connected to local resources and local organizations who could provide some financial assistance in the case of more of these immediate health-related social needs. They could provide housing resources, access, and information about the food pantries, caregiving resources. Other websites that can be useful is childcare.gov. And so this website provides information about some benefits that might be available to families with children. And so financial assistance as well as some information about childcare resources, housing resources. Similarly with eldercare.gov, it helps to connect individuals who are caring for older individuals, older relatives. It connects them to caregiving services, respite services, as well as some financial support. And there's a place where they could review their benefits and whether they're receiving all of the benefits that they're eligible for. So this could be helpful for our patients who are often sandwiched between taking care of their children and taking care of older relatives while also dealing with these social determinants of health. And I encourage everybody to also utilize and be aware of the case management resources that might be available through some patients' insurance companies, because social workers can really be key in helping to navigate some of these lengthy housing and benefits application processes. I know I've been collaborating with our social work school and some of the social workers in our departments to really help streamline access to these case management services. So I'm going to end here and turn the floor over to Matt. So thank you, and I'll be happy to answer any questions later.
Thank you, Dr. Heimowitz, for a great presentation. Laying out the foundation for those social determinants of health and all the health disparities that all of our patients, in our population might experience, or maybe they're experiencing multiple disparities at once. When I address nutrition with our patient population, especially that have health disparities, I do like to take more of a direct and simplistic approach. I feel that's very helpful for me, especially giving all of those health disparities that they have going on. It's one more thing added on to their plate. So again, I like to keep it a little bit simple. Nothing I have today is novel. But again, I'm going to share my approach and then just some powerful tools that we use here at The Ohio State University to help our patients. So I'm briefly just going to talk about shakes, vitamins, and our SNAP program that we have here in Ohio and then, nationwide. I do feel that at the beginning, when I initially work with patients, we want to focus in on protein and vitamins. I find that it's the most cost-effective and most efficient way to either maintain or improve nutrition status post bariatric surgery. Once I can establish adequate protein intake, we find a way to get them on a vitamin regimen that's suitable for the type of surgery that they had. Then we'll start working in on that diet quality. So the types of foods that we can help them acquire and intake on a daily basis. So, diet quality is synonymous with long-term success. And so I like to focus in on 3 key nutrients with that, and that's protein, fiber, and any foods that are containing vitamins and minerals. So really, again, a very simplistic approach, but very direct. And I find that this is very helpful for our patient population. So when we talk about protein shakes, we are assuming some tolerance and palatability. Not everybody likes protein shakes. I certainly understand that. And we should be aware of that, it doesn't work for everybody. However, it really is a great option, especially for individuals who, might be on food stamps or just, have low income and things like that. So I just have a couple examples here that I found or that I like to kind of promote. Most patients do shop at Walmart. If they have an Aldi nearby, that can help too. Uh, each of these grocery store chains do have their own protein shake, their own brand. Walmart is the Equate brand, and Aldi is the Elevation. When we break down the cost, if we do one shake per day, so that's 7 shakes in a week, it really is only $11 to $12 per week. If we do two, which is our minimum goal, that reaches our minimum goal with just 2 shakes a day, it's about $24 a week. Even more cost effective is using protein powder. Both, Aldi and Walmart do have their own, protein powder brand. It's even less. So it's, one serving of protein is about $5 to $6 in a day. And then, 2 servings, which will be about 60 grams of protein. That's about $12 a day. So very cost effective and a very quick and easy way to get in their protein needs. One thing to really highlight is that protein shakes are SNAP eligible because they have a nutrition fact label. They can use their SNAP benefits to purchase protein shakes and protein powder. So that's a very positive benefit for our patient population. Once we establish adequate protein intake, or at least a plan to increase protein intake, or at least have that, I do move into our vitamin regimen. We are assuming a standard generic regimen. So that is about, 2 adult multivitamins, completes or prenatals, both with iron, some sublingual B12, and a couple doses of calcium. We always check insurance first. Oftentimes, many insurances can cover just generic vitamins for patients. So we always start there. And then really working with the patient on where they shop and maybe they shop online to really kind of mix and match from different stores to put together, the regimen I just mentioned above, buying from different places or maybe just all in one, for example, we can do that at Walmart or maybe even online with Amazon. And when we find the adequate regimen, it really can be only about $75 to $100 a year for a yearly supply on that regimen. If we really, take the time to spend with them to figure out what they actually need and to be able to purchase. So again, very, very cost effective, very cheap option to just improve their nutrition status right off the bat. A couple other options that I've found. Celebrate, which is a bariatric specific brand, does have an assistant program named Celebrate Assist. It's not always guaranteed. They have to fill out a question, a form. The questions are, about income and Social Security and government assistance and things like that. So we usually help them out with filling out that form and helping them turn that in. Another option out there that I like to promote is Bariatric Fusion. It's another bariatric specific brand. I feel like they make good products. They do have a coupon code where it's 20% off a single order. You can use it multiple times. There's no, limit to how many times they can use it. They have a couple of really good vitamin options out there that could really, boost their vitamin intake. So really talking about SNAP and EBT benefits, the government does have some really powerful tools to help patients. Remember, protein shakes are SNAP eligible, so that's a huge bonus for them. The SNAP website, you can click on the state and you can immediately, type in your zip code and you can immediately find participating, online retailers that take SNAP benefits. You can find farmers markets that are near those, near that zip code that do take the SNAP benefits. And then among all of the other grocery stores and gas stations and other places where they can find, have access to food and nutrition that do take the benefits. Online retailers are a great option for those without transportation, or if they, maybe live in an area where there aren't as many farmers markets or other, accepted options for those SNAP benefits. So, and we'll talk about those here in a minute. So those online resources, just really highlight a couple, Amazon and Walmart. So Amazon, their Prime membership is half off to SNAP members. They can use their EBT card on eligible food items. They can have them shipped to their home for free. As you can see, free shipping, with orders over a certain amount. So usually that's, not that hard to accumulate for them. And then also using that Amazon Fresh option. So again, they can get things delivered. If they don't have transportation or limited access to transportation. And then a very similar option with the Walmart Assist program. Their membership is decreased for SNAP participants. And then they, have free shipping, free online, free store pickup. And they can certainly use their SNAP benefits for those eligible food items that they can find online. So another really powerful tool for those that have no transportation. Another great, powerful tool that we like to promote is myplate.gov. They do have this app. It's called Shop Simple. It's free. You don't need to be on SNAP to use this feature, but it is a good feature for SNAP participants. Again, you can type in your zip code and you can find local farmers markets within, up to a 20-mile radius based on your zip code. They also have the powerful tool to find eligible stores and farmers markets and online stores that take the SNAP benefits. They have EBT rewards and incentives. Sometimes, they will give you, if they're using their SNAP benefits, consistently, they can build up rewards and have access to other incentives. And then on this resource, this app, you can find budget-friendly foods, food items, what food items are in season that they can find at the local farmers market, so it's a cheaper option, and then certainly some recipes to help, prepare those foods that they're purchasing for them. I also encourage everyone to use their local food banks. Most, central food bank locations, especially here in the state of Ohio, where I'm at, and I'm sure as others, I looked at a few other states and they do have this, a similar resource, but they do have either a calendar or, you just kind of type in a zip code and it offers the locations and the dates and the times of, food donations and things like that. Our option here in Ohio it's called Fresh Track. You just type in your zip code and it just pulls up a whole list of the locations, and it has the times and the dates and things like that. And then there's just some other resources that we have, like the Mid Ohio Kitchen, just other sharing the locations and times of where they have like the community meals for us. So like I said, nothing novel today in terms of nutrition, but again, I like to keep a simplistic approach because of all the other things that they have going on. And then really utilizing our government resources. They have very powerful tools, and they're there for their benefit. So that's all I have today, and we'll turn it over to Kathy to talk about our exercise and physical activity. Thank you.
Thank you, Matt. So, as you know, I'm Kathy Tuppo, and I'm delighted to be talking to you today about physical activity, obviously a topic that is near and dear to my heart as a physical therapist. So when we talk about physical activity for our patients, Many of this is going to wind up being patient driven. So it's important that they have a plan and they have knowledge. So some questions that we might encourage them to ask: what should I look for? How do I know that it's valid and safe? Do I need prior physical activity experience? Should I see my doctor first? In terms of self-awareness and understanding, finding their why will give them motivation. So asking, what do I like to do? Do I have any constraints? Is it time? Is it physical ability? Maybe it's financial. And what do I need? What tools do I need? Do I have space at home? Do I need a computer? Do I need transportation? How will I get there? Do I need social support, possibly childcare or elder care or some other support to enable me to access an activity program? And obviously, language equity is important. So we'll be talking about some low-cost options today, some self-directed options, things that can be done at home, some creative ways to make weights. We'll be discussing online resources, video libraries, and then we will be discussing some community-based opportunities as well. I'll give you a minute to just look at that slide, but that's okay. Okay. All right, we can go on. Thank you. We're good. You can go to the next one. Thank you. So when you're looking, no, I'm sorry, Matt, can you go back? Thank you. So what should someone look for in terms of content? We talked about stigma. Dr. Heimowitz mentioned this. So you need to look at the tone or the culture of the videos or the classes. Being without weight bias is really, really important. The option levels need to meet someone's physical function in terms of, are they a beginner? Should they look for a gentle class? Or are they advanced? Which may mean a program that's very active, will sweat. Are chair options available? Possibly aquatic options if somebody has issues with joint pain, and are options supervised or self-directed? And probably the most important thing, is the content valid and can it be trusted? There, as you know, there is so much information that's available online that people may get caught up in. But in terms of value and vetted and evidence-based, usually government websites, university websites, other nonprofit organizations, and hospital websites are wonderful sources for reliable information. And when someone's looking for what to kind of pick, the description of the sessions is really important. Next, please. So let's look at some creative strengthening assists. So not everybody has to buy weights. We can use what's in our food cabinet or our water. So a soup can is about a half a pound. A bottle of water is about a pound. If you want a little more weight, half a gallon of water is 4 pounds. A full gallon jug is 8 pounds and can kind of mimic a kettlebell. So using things around the house to help you get started with working on strengthening activities can be really helpful. Some people even advise using dried beans or getting, a pound of lentils, something like that can be used as a weight. So not being shy about this and being creative can help somebody easily access some strengthening tools. Next, please. Resistance bands are also another inexpensive option. And if you're not familiar with resistance bands, they're in different colors. It's not to keep them pretty and kind of matching your decor, but really the color of the bands indicate the amount of resistance that they're going to provide. The resistance bands can be used for upper body and lower body strengthening. And they're, like I said, they're very inexpensive. They're easily portable and a good tool for someone to utilize at home. Next, please. Using someone's own body weight is really, really helpful as well. Doing wall push-ups, sit to stand. If you do mini squats and slowly stand up and sit down without touching the chair, you'll begin to gather leg strength. More advanced might be sit-ups. More advanced might be doing forearm planks or regular planks. If someone needs assistance with mobility, utilizing a chair for leg exercises can be helpful as well. And all these are available within someone's own home or within their own work environment. And really that's key because this will enable someone to integrate activity throughout their day. So they don't necessarily have to schedule a time to do it, but little things throughout the day will help them as well. Next, please. Another thing that can be done at home or in the workplace is aerobics. And aerobics can be modified depending on someone's physical ability in terms of using a chair or standing, marching in place, doing higher knee lifts. These are all options and certainly doable, like I said, in home or the work environment. Next, please. Flexibility can also be done at home or in work, and flexibility improves joint range of motion and is important after an exercise session to help the body recover. So we usually think of stretching as a means to improve movement, but it's actually a way to improve recovery and is recommended after an exercise session. Continue, please. There are a number of options for seated activities, and believe it or not, NASA has this great booklet that's available. You can download it. It's called Desk Exercise, and it goes through a whole number of seated activities that someone can do at their workstation or they can do at home. There are various other seated options. This is just an example of a seated yoga program that, again, can be done at home or can be done at work. Many of us spend our time at work seated, and taking mini activity breaks throughout the day helps to build toward that activity goal, but it actually will help you kind of regain your mental focus and can help minimize the strain of sitting for prolonged periods of time. Continue, please. And of course, we talked about home, but let's think about other things that can be done at work. Having walking meetings can be helpful. When you're at work, maybe walking to a bathroom that's further away from your workstation, maybe on a different floor or at a further distance, parking your car further away from the entrance to either a shop or your work can give you more steps. Accessing parks for sports, and absolutely using your friends or family to go outside and move about will really be helpful and will create enjoyment. So using what's around, knowing what's available in your community can be extremely helpful in allowing someone to access activity at no cost to them. Next, please. I want to talk a little bit about some of the online resources that are available. So the U.S. Department of Health and Human Services has a program called Move Your Way. And this is from their website. I'm going to go through this just a little bit. So you can choose options for adults or older adults. The wonderful thing about this information is that it's available in English and the exact same information is available in Spanish. So it's really, really a wonderful tool. Next, please. I'm going to go through some of the pages. So what this will do, it will help somebody set up an activity plan. We talked about planning as being important. So they can select why they want to do this. So again, what is my why? Do I want to be healthful? Do I want to feel less stressed? Do I want to sleep better? So they can select the why. Continue, please. And then select what they're interested in. Do I want to be active by myself, or do I want to be active with friends and families, and so on? Show me activities that I can do indoors, outdoors, at home, away from home. So you select these items and then it will help you create a plan. Next, please. There's many, many different options for activities. Continue, please. As you can see here. So once somebody makes all these selections, it will come up with a plan for them. And the net result, it will give them kind of an activity tracker where they can input their information. There is a motivational video that's super valuable that can help them latch on to reasons to keep continuing. So while they have to choose these things and do it themselves, it allows them a framework to set up their activity plan. Next, please. The Veterans Administration has a wonderful library of online videos. And these videos can be utilized with anyone of any age and any physical function. So they have seated activities, they have things that are more advanced. And while this particular link is called Gero Fitness, it's really valuable for anybody of any age. So don't be put off by the fact that it may appear to be only for the older population. Wonderful, wonderful tool for people to use. Next, please. AARP is another option, not that I'm focusing on the older population, but AARP is available for anybody over the age of 50. And you know, many of our patients fall in that age range. So AARP membership is nominal for the year, and you can actually get a second person to be free membership if they live in the same household. They have online videos that I'm not going to discuss here, but they have live classes, which is really important. Being engaged, knowing when you're going to do this, and being able to interact with other people in a live online format can be really helpful for engagement and enjoyment. And there's various options. Very, very nice offerings that they have. Continue, please. The National Institute on Aging is another wonderful, wonderful website. And again, yes, it's saying older adults, but the great thing about this is they have seated, they have standing, they have various options for intensity. A whole host of videos. This link says there's 22 videos online from maybe 5 minutes to a half an hour. So lots of options and free. Really great resource. Continue, please. If someone's a little overwhelmed with searching the internet, one of the websites that might be helpful is the nutrition.gov. So this website provides a central hub for links to other websites. So it might be a good place to start if somebody's looking for resources and not to get overwhelmed. The exercising on a budget, if you can see that in the lower left, is actually a printout, a PDF that someone can access for information and suggestions. Next, please. We need to talk about weight sensitivity and stigma. And you know, things exist out there, and these are going to be totally off-putting to our patients. So it's good for them to know that these kinds of images and messaging exists. Even though individuals might be of a larger body habitus who are performing some of these activities, the messaging is a little bit off-putting for sure. And then many other online sources have trim and fit individuals who are doing the exercises, so it might not be relatable. That bottom right one is actually exercising with a 15-pound kettlebell, and you can go from the picture on the left to the picture on the right. Again, extremely off-putting. Continue, please. The good news is there are individuals who are working toward minimizing stigma and bias. And I have looked at these websites. There's Yoga for Bigger Bodies, done very, very well, very respectfully. Not that I'm promoting anybody's private business, but Anna Gasgelli has a wonderful online program. She offers free snippets for certain yoga poses, and then you can actually join her online kind of product where you pay, but there are certain free options as well. And she has books that she's published on body positivity. A very respected yoga instructor who is very concerned with inclusivity. Continue, please. Let's talk a little bit about shifting gears from online. Let's talk about in-person, some options. So there's many community venues that are available, and this will depend a little bit on your geographical location. In-person options can be at schools, libraries, community centers, shopping malls, churches, and even hospitals. The picture on the right where it says Mole Walkers Club, this is sponsored by my hospital, Stony Brook. There's a local mall. Individuals meet once a month and they take a walk around the mall before the mall opens, and linked with this are also educational talks. So very important to kind of find out what you're in your community that are low cost. Continue, please. Gym memberships should not be ruled out. There are low cost options and low obligation, better to pay month to month to see if you like it than to commit to a full contract. And some insurance companies will cover gym memberships. It's worth asking. And some yoga studios provide discounts. I know the one that I practice in has a senior discount, and they have classes. If you purchase a number, you get a number of classes, you get a discount. Next, please. Some online resources are like I said, are valuable. The National Institute on Aging, the Veterans Health Administration, the CDC, and the Department of Health and Human Services have great resources. Next, please. I mentioned the USDA nutrition website, the Arthritis Foundation, Curvy Yoga. Other websites are available as well. The American Council on Exercise has various options. So there is a lot out there. It just takes a little looking. Continue, please. So in closing, what are some tips to help our patients? So it's incumbent on us to know what's available in our area. It's important for us to have firsthand knowledge of online sources and to be able to educate patients on how to know if something's legitimate. Like I said, there's a lot of misinformation out there. Maybe engage an exercise professional to help cull this information and to vet it. And it's helpful to have an information sheet prepared for your patients that have websites and tools and video options and printed materials. Having something available to give to patients will enable them to access it more easily, because it is time consuming if it's left to someone to search the internet. Go ahead. Next one, please. So thank you for your time. This is my email address if anybody wants to reach out to me, and I'll turn the floor over to Dr. Franklin.
Thank you to all of our presenters. My goodness, you guys provided so much good information. I definitely am going to be changing some of the things that I do in my practice to accommodate some of the needs that I've seen that I didn't quite know how to address. I mean, I didn't realize that there were so many different resources out there. And I think that happens a lot. I think we kind of get used to doing the same thing and moving in the same steps and realizing that there's all these other different opportunities out there. That's another reason why I like being a part of ASMBS, because you not only get to work with people in your immediate state, but now you're working with people all over the country with very different ideas and ways of doing things. I am going to take some time to answer and address some of the questions that were put in the chat. If you have not put a question in the chat, but still are thinking about it, you can still put a question in the chat. I am still managing it. I do want to start with one of the questions that has come up is in regards to the garden that you talked about, Dr. Heimowitz, on top of the roof. There was some questions about who maintains the garden. How do you fund the maintenance and planning and all of that?
So it is a great question. So it's an initiative that's maintained by our nutrition department through our preventative family medicine department. And it's maintained on a day-to-day basis, mostly by volunteers, by students. Some of the nutrition dietetic students really do a lot of work. You also, at our institution, we do a lot of fundraising and try to get funds raised from like alum, and there are individuals who kind of focus on kind of advocating and kind of also pairing different programs with appropriate grants that could support some of these projects and programs. So it's a collaborative effort for sure, and it's a testament to the hard work of a lot of individuals to continue to maintain a program like this.
That's amazing. At our center, what we do is we've partnered with the farmers market. And so we give people vouchers so that they're able to utilize that voucher at the farmers market without paying any additional money. We've marketed as a food as medicine program. And so that's another way of kind of helping people get to those healthy food resources. Matthew, what you were talking about with what Walmart's able to do to actually deliver some of those items, that's amazing because transportation still continues to be one of the top social determinants of health that impacts care. What do you think is Matthew, this question's directed at you, the best or the most useful app to assist patients with being compliant with some of those nutritional guidelines that you discussed early on?
I wouldn't say it's any one app.
Okay.
Like I said, I like to kind of focus on making like protein first. We have a protein first mentality. So making sure we're getting that in first. And then, kind of like you said, trying to get better quality foods in them. So really that Shop Simple app is something that I use all the time.
Okay.
It's a fantastic resource, especially to get patients out in the community and utilizing their resources and get access to fresh stuff. They're not, getting food at bodegas or gas stations and things like that. So, using different resources to get better quality foods. So I like using that app. I think it's really powerful. And it's very easy to use too.
Okay. Kathy, do you have any apps that you would recommend in regards to tracking physical activity?
Yeah, that's a great question, Dr. Franklin. There are so many apps out there that they're really individualized that I don't necessarily recommend any one. What I do recommend is it needs to be needs to meet the patient where they are. So it needs to make sense to them. So I would ask them to take a look at it, low cost, try it out, see if it's meeting their needs. So again, starting with a plan of kind of what they want to see happen will enable them to kind of match finding that app. So there's a lot of stuff out there, but I really ask them to kind of take a look at that. So I personally steer away from recommending the apps. I may ask them to kind of use their health tracker on their phone, although that can erroneously count steps when they're not really moving. It depends, but I would start there and then go from there. I see Dr. Heinwitz shaking her head. You might have a suggestion too.
I have a question you already answered it. Thank you. Matt, is that answering Sharon's concern about the Shop Simple app? Okay, thank you. Appreciate that.
I think you have to use a QR code. You just put your phone up and kind of open it up.
Perfect. There was one concern, and anybody on the panel can address this, that came up in the chat, and there is a concern about government cuts and how that is going to impact our ability to address social determinants of health in the future. Do any of our panelists have any words of wisdom on how to kind of navigate our new reality?
I think there are a lot of concerns about maybe potential losing some benefits for our patients, and it will significantly increase health disparities for our patients. So I think that's why it's important for us as clinicians kind of working with other patients to really educate ourselves about our local resources, to really collaborate with some of those community-based organizations, really know what's available and keep track of what's available at the local, like the state level. So that if the more federal resources aren't as accessible, that we at least have something to work with. But it will take a lot of us kind of working together and being very creative about how we can meet our patients' needs, even if there are some cuts to other benefits available.
We have come to the end of our hour. That was so quick. Thank you guys for joining us today and being such an engaged audience. We hope you found this webinar valuable and helpful. A huge thank you to all of our panelists for their informative presentations. Before we wrap up, we want you to know that there will be a recording of this presentation on the ASMBS website. And we are going to have part 3 of this webinar that will be marketed to you pretty soon. So if you enjoyed this webinar, please join us for part 3. Again, thank you once again for your time and participation, and we hope to see you at future webinars. Have a wonderful day.